Malnutrition has remained a big issue for many states in Nigeria, but for Kaduna State, the situation is particularly critical. With 47% of its children stunted and 37% severely wasted, officials say the situation is an emergency in Kaduna State. Quoting the MICS survey indices for Kaduna State, Hajiya Hawa Usman, nutrition officer for the state, explained the need for an emergency nutrition program in the state.
Kaduna State, we have stunting rate at 47%. The children of Kaduna State, 47% of them are stunted. And then there are about 4% of them are severely wasted. And when you find out that we have above 5% is being wasted, it's an emergency. And Kaduna State has more than that. So this calls for Kaduna State Emergency Nutrition Action Plan so as to curtail this issue of malnutrition in Kaduna State.
Led by the Kaduna State Primary Healthcare Agency and KADENAP, the emergency nutrition program in the state is strengthening preventive approaches to combat malnutrition. KADENAP is the Kaduna Emergency Nutrition Action Plan. It was set up as an initiative of the governor of Kaduna State in response to the crippling number of malnourished children. With 267,000 children severely acutely malnourished in the state blessed with many nutritious foods, every effort to turn the numbers around is needed. Program manager for KADENAP, Zainab Muhammad Gwaru, says the program was not established to replace institutions and ministries which should implement nutrition programs.
KADENAP, it was set up to catalyze, to stimulate, and to also ensure that things are done on a timely basis. That's why it's an emergency, entity or institution. Not so much as a structure to take over what is already existing in terms of the institutions saddled with responsibility of providing nutrition intervention services.
For this reason, every Wednesday, Ladi and her team stand before a gathering of community women at the PHC. The community women have come seeking care for their sick babies. However, Ladi and her team know that the root cause of many of the illnesses presented with is malnutrition. So after clinic sessions, mothers go to the demonstration corners where health workers give practical lessons on classes of food and how to combine local ingredients to produce nutritious meals.
If you look at the causes of malnutrition, one of the most causes is ignorance, not poverty. Because even if the money is there, you don't have the idea of what to cook for a child at the right age, at the specific time and the right amount and quantity, you will not do the right thing.
The local foods, we tell them that are affordable and you can get in the community are corn, which they can make tuwo with it, and rice, which is very common. We have yam, sweet potatoes, Irish, beans, we have granuts, we have crayfish, and we have soya beans. These locally foods, they are not expensive. So we advise them to go for the local foods that are within the reach.
There are 57 CMAM sites in the state, but this PHC records as many as 2 to 6 new cases of malnourished children every week. Little Freddie was one of such cases. He was coming in for his second dose of RUTF when we spoke with his mother. A community volunteer noticed his symptoms 2 weeks before and advised Tina, his mom, to come to this CMAM site. Tina said he had been running a temperature, stooling, and came into the PHC weak and unable to sit, stand, or play. But after a week of taking the medicine in a sachet, he is strong enough to explore around our microphone.
Started with hot body. He started purging. Then I took it to hospital. Then say typhoid and malaria before we came here.
The Nigeria Health Watch team visited another CMAM site in Hayadami PHC. We spoke to Amina Ladan, the health facility in charge. She said that she wondered about the relevance of the intervention to their PHC since it is in the city center. Well, she quickly changed her mind, however, on the first day the nutrition program started there. On that day, they registered 45 malnourished children and admitted 15 of them for acute malnutrition.
When you look at the environment, they have all the nutritional food that they can prepare by themselves. The zogale, the fruits, but how to make it is the problem.
Kaduna State's nutrition program incorporates preventive measures to combat malnutrition. Lessons in hand washing and hygiene to prevent infections and malnutrition form part of the bedrock of KADENAP CMAM classes. The other important component of the program is the food education, where community members are taught how to prepare nutritious meals using locally sourced and inexpensive meals. There is more to be done to change cultural beliefs that hamper progress of nutrition interventions, including outreaches to community members and men about the importance of the CMAM program. We hope Kaduna State and all of Nigeria will keep working to improve our nutrition indices.